Hello, everybody. I'm Mohammad Rafieetary. I'm an optometrist at the Charles Retina Institute in Germantown, Tennessee. The lecture was about how patients are experienced when they're referred from eye care providers in the community who will need injection. So there were a number of patients interviewed in this presentation. There were some of my colleagues were interviewed, so I have their videotapes that I showed at the lecture. Also, there is some, there was some interaction between me and the attendees. So pretty much many of our colleagues don't really realize they don't come with patients when they're referred to a clinic like ours here at Charles Retina, which is a retina clinic. In a given day, maybe 100 patients get injections in this clinic. So they don't realize what these patients experience, and the patients take the message from our offices to the referring doctors. Sometimes referring doctors refer the patients without telling them they're going to get an injection. So it's a surprise to the patient. The patients are always concerned, is it something that's going to hurt? So we have to calm that down. We have to explain why these conditions are chronic in nature, and these patients may need continuous care and have to keep coming back to our clinics. But one of the most important message is for our colleagues who refer patients to clinics like this to make sure they have some periodic follow-ups with their patient, not only to encourage them to stick with the treatments they get, but also to take care of the other problems the patients have. Patients always talk about their anterior segment disease, and the way I explain to the patients that is like if you go to a neurologist, you don't ask them about the dandruff on your scalp. So it's not that we're ignoring your dry eyes and things like that. We really don't have time in clinics like ours. I'm speaking right now from my clinic. I had 56 patients on my schedule. So I have to go from room to room to room. So we have to neglect some of the stuff to take care of what they're really here for, the retina disease. So the lecture is around this concept of when the patients are sent and they become to what I call a needle black hole. Basically, they have to come back and forth to get macular degeneration, diabetic retinopathy, diabetic macular edema, retinal vein occlusion patients. So all of these are conditions that we have to deal with. Thank you all very much.